a GP pharmacist and I'm your host on today's health show on British Muslim TV. Now, in today's topic of discussion, we will be discussing mental health. Now, I know the pandemic has had a huge impact on mental health for both adults and children, and mental health in children specifically has not been spoken much of about. So I do have a very special guest. Her name's Dr. Andleeb. She'll be answering a lot of our questions regarding mental health in general, be touching on mental health in children, signs and symptoms to look out for when it comes to mental health, and also hopefully touching on the postnatal depression. So Dr. Andleeb, thank you so much for coming on the show. How are you this evening?
Hello, good evening. Assalamu alaikum, everybody. Thank you for having me on the show. I'm fine. How are you?
Thank you. I'm good, thank you. Surviving the long day at work today. It would be nice to actually introduce yourself to everyone. I think you have actually come on the show before where we had a menopause segment. And so thank you so much for coming back on. And please remind us what you actually do.
Absolutely, my pleasure. So I was previously on with Dr. Sultana. So as you said, my name is Dr. Andleeb Ahmed. I am an NHS GP. I've been in the NHS for, 28 years now. So I'm quite much older than you, Nyrah. And so my special interest and my passion is mental health. And I'm also a mother to three, alhamdulillah, children. And I'm based in northwest London. That's about it, really. I mean, in a nutshell, really.
Nice, thank you. And our topic of today is mental health. A lot of people hear the term. Mental health is actually an umbrella term for a lot of many other diagnoses. What is mental health to you, and how would you kind of describe to someone what mental health is?
Yes, so mental health in particular, especially in the sort of like the Southeastern Asian community, is a very taboo subject, and we're trying to, and programs like this are breaking down these barriers. Mental health is just as important as physical health, and just as it's important to look after your physical health, looking after your mental health means you're able to think and sort of like react and function every day in the way that you want, really.
And what are the common kind of diagnoses within mental health? So I know there's anxiety, there's depression. What other kind of diagnoses does it cover?
So you covered, the commonest one people, have heard of is anxiety and depression. However, within anxiety, there's subgroups that we now recognize. There's panic attacks. Within depression, there's postnatal depression. There's even something called seasonal affective disorder. And then there's things like phobia, there's eating disorders, there's schizophrenia, there's psychosis, there's personality disorders. Mental health is a massive, huge topic. I could talk for hours on them, but I don't want to bore your viewers. But they are very, very important topics. And I think it's really important to, recognize that, doctors are getting more of an understanding of the different types of mental health issues there are.
Definitely. And I think a lot of doctors now, they are taking the holistic approach where they're treating a patient as a whole. It's not about just the current disease that they have, but, how are they feeling? How is their mood? And how's that impacting their day-to-day life? I know anxiety has been such a big problem for a lot of patients at home, staying at home, being locked up in around four walls, working. And especially anxieties in the children as well is becoming more and more common. What are the common causes of possibly anxiety and depression? Would you say in your kind of primary care?
So in primary care, if depending on the age group, and you touched upon, the increasing amount of mental health issues we've seen in general as a result of lockdown. So, if we touch upon anxiety is is a condition where you tend to feel agitated, restless. Your mind is sort of like all over the place. You can't focus on things correctly. You have poor concentration, and you tend to worry about a lot of things. You may have physical symptoms to go with that, such as sweating, palpitations. You may even sometimes feel, like you're getting chest pains and breathless. Having a severe panic attack, when my patients describe it to me, they say it sometimes feels like they're about to die. It is a terrifying situation to be in, having a panic attack. Depression is the sort of like the other spectrum. So that is when you're feeling you have a low mood, and that can present with, you just don't feel like you feel a bit detached from everything. You're tearful, you lose interest in things, things that would normally give you a little bit of joy. You just can't be bothered. You start withdrawing from your friends, your work. You don't look after your appearance, perhaps. And then it can start bordering on things like, quite negative, dark thoughts and and even thoughts of harming yourself. And that is when it sort of reaches that stage, you try and avoid getting to that stage, but if it does, that's when you need to get medical help.
Definitely, and thank you for giving kind of pointers that everyone should really be looking out for when it comes to looking after their own mental health. Mm. And you mentioned before, it's such a taboo topic, not many people feel confident talking to a healthcare professional about their own mental health. Why do you think it's important, we speak up about our own mental health?
I think it's because it's so important. If you, for instance, had a pain in your arm and you go and see a doctor, why is my arm hurting? Because you can't function. So if your mind isn't functioning like it should, you're not going to be able to, engage in things like your daily activities or engage in society or even look after yourself. And there's nothing wrong with having a mental health issue. There's people, especially, as Muslims, one of the things that, I'm starting to, try and encourage people to think about is that sometimes people think it's a sign of poor faith, which is absolutely not true. For people who are, all our viewers who are Muslim, I just wanted to remind people that, even our beloved Prophet ﷺ had a year of sorrow. And, if it is such an important thing, it's nothing to do with your faith whatsoever or lack of it. And in fact, looking after yourself is promoted in Islam, both mentally and physically.
A very important point to mention, definitely. And earlier you mentioned signs of depression or signs of anxiety. If you could summarize to our viewers as well, what kind of signs could you particularly look out for to show that your own well-being may be at risk and you might actually need further help?
Yeah, and these symptoms and signs also, I think especially if you're looking at your children, because they sort of present a bit differently. You'll notice that they may be withdrawing more to their room. They may be much more on their devices. They don't feel like talking. They may not come down for dinner. But then, in adults as well, it's that low mood, that tearfulness, feelings of, overwhelming worry, palpitations, the worry, the stress. And the most, is the lack of interest and detachment. And, you notice that your friend isn't coming out as much or is not engaging as much on a WhatsApp group even. And you just notice, oh, I've not heard from that person for a while. Checking on those people who've gone a bit quiet, especially with lockdown. And just, sending a message saying, hey, are you okay? Assalamu alaikum, are you all right? Can make a huge difference to somebody, that someone's noticed that they're not their normal self.
Definitely, just speaking up, talking to other people, talking to your loved ones, your friends, it can have a really big impact on your mood. And just having that face-to-face kind of contact, has shown such a massive impact on the pandemic as a whole. Not being able to see people, go to their houses, The impact on mood and anxiety, it's been phenomenal. And
but also,
talking about teenage, yeah, sorry, go ahead.
Sorry, I was also going to say that, living through COVID, has been even could be classified as a traumatic event, and especially, as frontline healthcare workers, we're seeing a lot of people go through post-traumatic stress disorder, but also those people, lots of people in my community who didn't get a chance to say goodbye to their loved ones, who were, and for us, that's a big thing, and not saying, and not being able to maybe sometimes be present at a janaza, or not being there, and that has had I cannot tell you what a huge effect that has had on people's mental well-being. So that, even that could have, the causes of depression, mental health issues are many, as you know, as a clinical pharmacist, you'll know this, but, life events, childhood issues, traumas, social, poor, social issues as well, they all contribute to, can contribute to a mental health issue.
Definitely. And, just not being able to actually see your loved one in the actual hospital, that's had such a negative impact, going forward. I'm not too sure if it's going to be easier or harder. We don't even have a good kind of status right now of where COVID is actually heading. We are actually coming towards the break very soon, Dr. Andleeb, so it'd be nice if we maybe end here, and in part 2 we can cover a bit more about teenagers, signs to look out for with their well-being. I know schools have a really important role when it comes to mental health in children, as it's so important to actually always monitor their mental health, throughout their different educational years. Join us again for part 2. We'll be going more into detail, mental health, postnatal depression. So please join us after the break. See you soon. Welcome back after the break. My name's Nyrah, I'm a GP pharmacist, and I'm your host for today's health show on British Muslim TV. Now, in part 1, we introduced our lovely guest, and our amazing topic today is mental health, but particularly in children as well as adults. So, Dr. Andleeb, lovely to reintroduce you to our guest.
Thank you for having me back in part 2. You haven't kicked me out.
So, part 1, we talked about signs that your own mental well-being may be at risk. Yeah. I did actually forget to ask you about mental health and genders. Is mental health more common in men or women, or is it equal from your kind of perspective?
So I think the common thing people think is that mental health issues are more common in women. However, there are certain types of mental health issues that are common in women and some in men, and more in men. So mental health issues in women tend to be the depression and the anxiety, whereas in men, it tends to be things like substance abuse, addiction, and schizophrenia and psychosis. So to me, I think it's an even thing because I see a wide range, and to me it's equal. And I think it's important to say that because I don't want men to feel that they can't come forward with their mental health. So there you go.
Definitely. So it is quite important that our men speak up as well. When they're facing difficulty or they need a mental break, they should really get some help either through their local pharmacist or their GP. I know there's a lot of online resources as well, which we'll definitely touch upon. And just bringing back the conversation to teenagers in general, mental health in teenagers are on the rise. Me personally, working in primary care, I've seen a lot of young teenagers being prescribed antidepressants, and it is quite growing to the point where you actually just want to pinpoint the cause of why are there so many teenagers going through the same problem, and why is anxiety being such a rising problem in the 14-year-olds to 16-year-olds age group. What are signs that your teenager may be, going through mental health on their own, or signs that parents should be looking out for at home?
So one of my other roles, I'm honoured actually, and I love doing this, is I'm actually a chair of governors at a local free school. So that's a secondary school. So I have seen the devastating impact COVID has had on children's mental health. So why it happens, it's a combination of things. Even before COVID, the mental health issues in children was on the rise, and I think it's a combination of, sadly, social media, peer pressure, feelings of belonging, and there's a huge pressure, as we know, to look, Instagram perfect, and this constant comparison that these poor children have to experience, that they don't look, their skin isn't flawless, they don't look like they've got a six-pack ab or whatever. And I think that pressure on them is far more than whatever I experienced. And I think, now add COVID to that, so that, in the teenage years, friendship groups are vital in development. It's how they recognize who they are in this world, and they form their identity. Now imagine putting that child away from their normal social interaction. That is why we've seen, these mental health issues creep up. They turn to, social media more, television more, and increasing. And they may have seen their parents lose their job. They may have lost even a parent or a grandparent, or, or a pet, and things like that. And it's just been overwhelming for them. And then online learning, which has been such a struggle for so many children. And not even being in that lovely school environment where you can have that banter with your friends and be silly, which is, really important. What do you look for is, what I mentioned before, you notice that your child is not their normal self. You pick up on things like they're refusing to eat. They're not maybe, interacting, going out with their friends or wanting to go out with you, not coming down for dinner, being, shut up in their room. Especially look out for signs that they're skipping meals, because that can indicate something to do with their, they may have body image issues. There's just so many things that they may be acting paranoid, or if they're acting, strange, that could possibly indicate, have they turned to substances? Peer pressure and gang pressure, especially in the cities, is a big problem. So these are sort of the things that you can look out for. Tearfulness as well, low mood, feelings of negativity. That's mainly secondary children. Obviously, little ones present differently.
Yeah, definitely. And I think, that social pressure, the social media impact on children's mental health, it has been just on the rise, throughout the pandemic, because more children, they're locked up in their bedrooms, they're spending more time on their phones. That's why, in terms of, practical advice to parents, I think even if they were to be a bit more strict and have like a timeout period where during the day they're allowed on their phones, in the evenings they have no phones. I know there's a lot of apps now that actually monitor screen time when it comes to children's iPhones. What other practical advice could you give to mothers or fathers out there to kind of help children that are going through a mental health condition at the moment?
So another, I'm going to shout out to my lovely sister Romana. One of the most important things that you can do for your child is ask them, are you okay? Because it's actually, I did a talk with parents, quite a large group of mothers in a mosque, and I asked, there must have been about 40 there, and I said, how many of you have asked your child, are you okay? And I think only 2 put their hands up. And I think that is my advice to parents, is that obviously put in things like, parent the parent screens that you have so they don't go onto inappropriate websites. Yeah, time out from screen, increase family activities. So like we have a board games day where I try to, with great shouting, put their electronics away and have just board games and, just connect again. What to film together, let them order their favorite pizza and ice cream and make it a family thing. But the most important thing you can do as a parent is ask your child, are you okay? And if they say, I'm not okay, don't say, well, why not? What's wrong? Or you've got everything you need, because that's not what they want to hear. Just allow them to talk to you and don't judge them. That is the best bit of advice I can give all my viewers. All my viewers. I'm so sorry, it's your show. All your viewers. So
no, all our viewers.
That's absolutely fine. I say that from my heart. Ask your children, are you? And it doesn't matter how old they are. Alhamdulillah, I've got a 21-year-old. And my youngest is 16, and if I don't ask them, I get told off by my sister because she's a therapist, and that is the most important thing. And she taught me that. So we can learn from each other. But as a mother, I've seen the difference that makes.
Definitely, just coming back to the very basics. That communication. If you're going through a mental health problem, I think the first thing you'd want to do is have someone there where you can pour out exactly what you're feeling, what you're going through, and it will feel like a big, massive relief, or like they've just taken off a heavy backpack off their shoulders, especially when they start talking. I think we are coming. Yeah.
So I was just going to say, because I feel really strongly about this, that if they don't talk to you, they may talk to somebody else who may not necessarily give them the best advice. So of course they're going to want their mum and dad or whoever their carer is. So I'm sorry, but
yeah, no, definitely. We are coming towards the end of the show very soon, but I know we wanted to touch on postnatal depression as well. We might not have time for that. Definitely, maybe save that topic for another show. We'd love to have you back on British Muslim TV. And I think schools have a big impact when it comes to mental health. What things do schools have in place for children that are going through mental health?
Yeah, I'm a huge champion for schools. Even though I'm a medic, I've seen what they do behind the scenes. So they are basically your child's, in a way, parents when they're away from you. So they obviously have pastoral care. Their form tutors will be keeping an eye on them, and they will pick up on subtle things as well. And a lot of schools will have counsellors that they can turn to. They have peer mentors as well. So there'll be like maybe sixth form students who will have who you can go and talk to. But it's very important for parents to realise that if you have any concerns about your child, primary, secondary, even sixth form, you can speak to the school and just ask them, look, I've noticed these changes, and you work together, because that will just give the child more support.
Definitely, and thank you so much, Dr. Andleeb, for actually coming onto the show. Raising awareness of mental health, I think is a very important reminder to viewers at home to really speak up when they can have that opportunity to. What I usually say to my patients is, even if you were to keep a mood diary, writing down your symptoms, writing down how you're feeling, that can have a really good impact on your mood overall, as you can kind of self-reflect on how you're feeling, what sort of things are actually triggering your mood, what's making things worse. As we are coming towards the end of the show, it would be nice if you'd like to say anything last. You'd like to say anything to the viewers?
No, I'm actually going to carry on with what you're saying. As everyone knows, getting a doctor's appointment is a little bit hard at the moment. So exactly what Nyrah said. Start talking to people. Do get help. There's lots of websites out there, lots of forums on different social platforms that you can join. But keeping a journal is one of the ways that you can actually help yourself. Definitely, 100%.
Right. Thank you so much for coming on the show again. Right, that's coming towards the end of our show now. Thank you so much for tuning in. We will be back again next Thursday at 7 p.m. to talk about exercise and weight loss. Join us again next week. Good evening. Goodbye.